As we cope with another stay-at-home order in Ontario, many people are feeling mentally and emotionally exhausted. This latest lockdown putting a strain on everyone's mental health. But with more Ontarians likely to reach out for help, will the system be able to keep up with demand?
There's no question there has been a very significant strain on the mental health and addiction system over the course of the pandemic. Many of our programs have increased in demand by 50% or more. Emergency mental health services in particular have seen a very significant spike in demand.
Camille Kenville, CEO of the Canadian Mental Health Association in Ontario, says even before the pandemic, mental health services were struggling with a backlog of people seeking support. Children and young people were waiting up to 2.5 years for services. Those needing residential addictions treatment waiting up to 100 days.
We are not yet able to say that our wait lists are manageable. We're still struggling with that. And we know that this third wave is going to impact exponentially.
The latest polling data from Mental Health Research Canada released in February found that the proportion of Canadians who rated their level of depression as high had increased by 70% since the height of the first wave. Social isolation was the leading stressor. Kenville says the provincial government has been in regular discussions with mental health organizations about the challenges they face, but says right now the system is reaching a breaking point. Do you feel at this point that if everyone who wanted help sought help, that there would be services there for them?
Absolutely not, unfortunately, but that was frankly true before the pandemic. So the pandemic has exacerbated what was already a chronically underperforming system. We have great conversations with government about that. They're keenly aware of the challenges right now. They're very interested in helping and supporting, but it will take resources because we will not have a recovery out of this pandemic unless everyone is mentally healthy.
Despite this, she hopes those who do need help reach out. Dr. Katie Kamkar, a clinical psychologist with CAMH, notes that while everyone is different, noticeable and sustained changes in sleep, appetite, concentration, and mood can be indicators that professional help could be useful.
If we feel that the symptoms increase over time, create more distress, please, important for anyone to know, do not suffer in silence. You're not alone.
If you're looking for mental health support or services and need a place to start, we'll have links to those resources on our website, citynews.ca/extras. For City News, I'm Erica Natividad.